Good afternoon. Welcome to Let's Talk Face to Face. My name is Hanna Getachew-Kreusser, Executive Director for Face to Face Health and Counseling in St. Paul, Minnesota. We have a monthly series that we have been doing about conversations that are relevant to our work at Face to Face. We provide care for young people in mental health, medical, as well as services for youth experiencing homelessness. Today's topic is about the healthcare that we provide. And our guest is Melissa Peterson. We are honored and privileged to have Melissa be a part of our team at Face to Face. And she leads the medical clinic team currently and has a lot of things to say about the work that we do to reduce health disparities. Welcome, Melissa.
Hello. Well, I'm thankful for everyone who's joining us today, giving us a little bit of your time to learn about what we do and maybe how you can be involved in it. I'm the clinic operations manager, and I've been at Face to Face since 2017. And we operate two medical clinics at two locations. One is our main clinic, which is at our arcade location in East St. Paul. And then we've got a smaller kind of satellite clinic at Safe Zone Drop-In Center, where we work with youth who are homeless, and that's in downtown St. Paul. Our programs for our clinic include our team who works at the front desk. We have health insurance navigators. We have medical services. We do case management, health education, and HIV testing outreach. So that's kind of the big picture of who I am and what I do at Face to Face.
Thank you, Melissa. So, sometimes it's not clear exactly what medical care for young people looks like. So would you tell us a little bit about what we provide at Face to Face?
Yeah. We have some things that are unique and some things that are common. So yeah, I'd love to share that. One of the things that we do is we provide our services in a way that they can schedule appointments. Young people can have same-day appointments or walk-in appointments. Currently during COVID, we're just screening everyone before they come to our clinic. And I just like people to know that we help people get to our clinic. So whether if they need transportation assistance or they might need interpreters, we can provide those too. But beginning with kind of the process is we can help people apply for health insurance. So anyone of any age, not just youth, we can help you with health insurance and seeing what you qualify for and what might be the best plan for you, or even just help provide screening. Right now, it's open enrollment for MNsure, and we have MNsure navigators ready to help. So that's always available. And so for our young people, it's very convenient to be able to apply for insurance at the same place that you receive services. We also can help young people apply for any assistance with programs that help pay for care, and we provide payment plans, reduced cost services, and we don't turn anyone away based on their ability to pay. So that's really important. We can provide services free of charge also. So that's a really key thing. So when we talk about the kind of medical services that are part of this, we have wellness care. So all those things that we think about, annual physicals, sports physicals, immunizations, those types of things are available to young people. We also do convenience care. And so a lot of times we think about those kind of clinics that, you can go into pretty quickly and access, help for things like, let's say a skin rash or an ear infection or an upset stomach or pink eye, a urinary tract infection, all those kinds of things we can provide help with. We also, because of our age group, if you think about that 11 to 24-year-old, we do a lot of work around reproductive and sexual health care. So it might be coming up with what is my goals for life and my reproductive, life, and do some planning with that and talk about what our goals are. We provide birth control, STI screening and treatment, pregnancy testing. So a lot of things around that area. That's some examples. We also provide care for pregnancy. So we have OB medical care, and we do that in partnership with United Family Medical Residency Program. And so we're really grateful for that partnership. So people can receive their OB care right on site. We provide case management for everybody who participates in our OB program. And we provide things like education on things like safe sleep or car seat safety. And then we can also support them with any kind of their material needs. They might need rental assistance, or maybe they need help with getting a crib, or after the baby's born, things like diapers, all of those kind of topics. The good news is we can work with the youth or, until their baby's 1 year old. So the prenatal and the after their child is born, we can continue to work with them. Our case management team really works to assist clients and coordinate their health care and whatever kinds of issues that are impacting their health care that is related. So I mentioned earlier about housing, could be employment, education, childcare, all of those kinds of things are available. We also provide free health education. And so young people or parents of young people or couples or families can sit down with a health educator and talk about anything related to reproductive and sexual health. And so it could be things like just the fundamentals about our bodies and how they work. We have demonstration models, all those good things. It might be about birth control, understanding, the different methods and what might be best for the individual. How to prevent an STI, lots of education there. A lot of young people want to talk to us about healthy relationships. What is a healthy relationship? How to set boundaries, how to talk about things in your relationship. We also discuss topics like consent that keep people healthy and safe, and then related topics like budgeting, self-care. How do I manage stress, especially during times that are really stressful? For a parent, we could meet with them to talk about how do you talk to your kids about sex? A lot of adults are not super comfortable talking to their young people about sex. And so we can help you get comfortable and have those conversations and answer questions you might have because you might not feel like you know enough. So that's another piece of the care that we provide. And then we also provide free HIV education and testing to anybody. So that's for all ages. And we can do it in the community, in our clinic. We can do that a lot of different ways. So when we talk about our medical services, that's kind of in a nutshell, all those kinds of things that we do.
Wonderful, thank you. So just to kind of follow up on what you said about kind of the conversation around sensitive topics, right? Specifically around kind of reproductive health or sex. And I think that, just even what it is and how it happens, it's amazing to me that in my experience, the number of young people who say the first time they ever heard anything about that is at school, not from their parents. And I do want to think that it's because just how uncomfortable that topic is, and not necessarily because parents don't want to talk about that. So that is really key here, is how do we have kind of conversation to prevent some of the outcomes of not talking about these things. I think this is key. So thank you, Melissa.
Well, and I think I want to just tack on to that, Hannah, too, is it might be good for people to know is, a lot of times we don't know when to talk to our kids about sex and when to start and what's appropriate for their age. Our health educators can help with that. And so it's never too early, but it's making it appropriate for their age. And also give parents some tools, because what we find is that research keeps telling us when parents have conversations with their young people and their children about sex and reproductive health, it has a lot of great outcomes. Young people are going to delay when they first start having sex. When that, you see that research shows that there's less likely to be unplanned pregnancies and those kinds of things. And so parents can really play a big role, but we know that no one's really teaching you how to do that. And so we're happy to help you and support you in that.
Great, yes, thank you. So, currently we're going through a very difficult time in our world, and face-to-face exists to support youth experiencing complex trauma and unstable life situations. And of course, this time really more than exasperates life for our young people. And our youth that we serve, close to about 90% represent the Black, Indigenous, people of color communities, right? So, and of course, that those communities have had the greatest impact from this pandemic, and the generational racialized trauma that is being passed on. So I think it would be important for you, Melissa, to touch on kind of what we do and in that way, like we healthcare. There's a lot of health disparities, right? We talk about what does it mean and what is our role at Face to Face,
Yeah,
and what are you also seeing, right?
sure. There's a lot of information right now on these topics, and there's been a lot of research. And so what we're finding, and everything kind of shows us that, for example, racism is a public health crisis. And it harms the people who are most vulnerable. We think about children and youth. And so over and over again, if you do any research on your own, or there's articles and those kinds of things, you'll find that it continues to show that people of color in the healthcare system are often not listened to. People are ignored. Their concerns are ignored. When they talk about pain, it's diminished, and people are not paying attention to that. They get rushed through appointments. They don't get their questions answered. They get kind of put aside. You'll find that they're also less likely to receive like follow-up on what's going on. And so I think a good example of this, I'll just share briefly, is I heard from a number of young people that when they were after their delivery of their baby, and they're in the hospital, and they were shown how to breastfeed, but maybe struggled and had questions, often they get brushed off by the staff saying, "Oh, don't worry about it, you can bottle feed." Well, we know that breastfeeding has a lot of benefits for those that can breastfeed, and to be told that in that setting isn't helpful. And so they're seeing this as they see it with race, right? These African American women. So what we find is that years and years of institutional practices and policies in our healthcare system have really had a negative effect on the outcomes for the young people that we serve, and for people of color, and it just hasn't been good. And so, you add to that this history of medical abuse that's gone on for generations, where that neglect and that abuse really has led to kind of a deep-rooted mistrust of the healthcare system. And so it's all kind of become this great big ugly thing that we have to think about every day in the work that we do. We have to do things differently than they've been done. And so with that knowledge of what's happened historically, what's going on now, what's gone on, for many years, as far as the system, the healthcare system, we really have to look at what we're doing and really seek to be culturally competent, to be welcoming, to be compassionate in our care, to recognize that there's that, the non-white majority of the youth that we serve have mistrust of the healthcare system because they've been neglected and abused by it, and over generations. So we know that to understand that health, you can't just think about health, I guess, like medical, physical health. Health is more than that. And you may have heard like the words like social determinants of health and those kinds of things. We really have to look at things outside of the healthcare system too. So for each of us, a lot of things impact our health that aren't physical body functions. The places where we live, the schools we attend, where we go to work, our culture, the relationships we have. There's so many other things that shape our health. And so we really seek to understand kind of the connection between the non-medical factors and, kind of the medical health factors in our physical bodies, to look at, like, how do we change those outcomes? So an example of that might be around something like, we know that stress, and especially chronic stress that you might experience with racism, you might experience with um, joblessness, homelessness, a trauma history that you've experienced, an abusive relationship, any of those things, that chronic stress changes our bodies, changes the way our brain functions, it changes our hormones. And research has shown us that it causes inflammation in our body, which is a marker for chronic disease. So if you experience chronic stress, you're more likely to have chronic disease. It's obvious. So those are things like, when you think about stress, we don't often think about how it affects our health in that way.
Mhm.
So if our youth of color live in homes or in communities that have higher unemployment, then we know that they're less likely to have quality housing, maybe good nutrition, access to, healthcare, access to high quality education. All of those things become a disparity that increases the risk for health problems. And so at face to face, when we look at all these things, the systems and the disparities and the social determinants, it's important that we see young people in this whole way, not just a piece or what they're coming today with. you know, I have this, I'll just share kind of
Yeah.
a silly example because it happens all the time. A young person comes in for a need. They're saying, oh, I need a checkup. And whatever that means. But then it ends up being, they have like, 9 things going on that are really complex, and they just got kicked out of the house that day and can't go home, and they're hungry at that moment when they show up for that medical appointment, which was really just a little checkup. um, and so we have to be able to have the time and the ability to listen and to be able to access all our resources at face to face and the whole community to ensure that we can address the needs of the young people that we serve.
So specifically, kind of what do you think is the role that we take on reducing these racial disparities, on fighting against systemic racism? What are the things that we've been doing and would like to do briefly?
Yeah, it's interesting. At face to face, we've been really focused on doing our work, what we call from a principle based kind of approach, not so much on rules and things. And so when we look at things from a principle base and that we apply that on how we connect with people, like one of those principles is building relationships. So building a trusting relationship with someone encourages them to be open. And then we can better provide information and resources and care when there's that trusting
Mhm.
relationship. So that would be an example of one way. Another way, when we think about how we do our work, is we have to meet the young person where they are, not where we think they should be.
Mhm.
Young people, I don't know about any of you, if you have someone in that 11 to 24-year-old range, but they don't usually appreciate your advice too much, if you haven't noticed. um, it's an appropriate developmental stage. They're in the age group where in the medical system, they begin to take more responsibility for their own health. They gradually take on more and more. And so learning to meet a person where they're at, not judge them, not labeling them, not being parental with them, not, advice giving or, shouting out the rules, is really key also to making sure their needs are met. We believe that young people, when they're given the information they need, can make decisions for their life and their health, and that they're the best for them. And so our job is to really provide them with information, options, so that they can make a decision. We don't want to decide for them. We
Mhm.
don't want to coerce them. Again, if you think about our audience, there's been a lot of medical abuse. So coercion is part of that. And so it's really important to give them what they need to make decisions. And so
Mhm.
when I think about this principle-based piece, that is one thing that face-to-face is doing our work in a way that really is principle focused um, for that. The other thing is, we've done a lot over the past number of years. We've been around for a long time, almost 50. So, but we've worked really hard on um, making sure, excuse me, that young people feel welcomed in our environment, and that we don't perpetuate any practices that keep them from getting care. So some of that is the hours that we're open, or that when I mentioned earlier, we have a combination of scheduled same day and walk-in appointments. I can tell you right now, most youth want to see us the day they call us or they want to walk in. It's just part of adolescence. You have a need, you're going to do it. You're not planning ahead for a lot of things. You're not thinking about preventative and wellness care. You're like, you have a need, you want it met now, let's meet it. So we try to make all of our medical services be as accessible as possible that way. Another way that looks is by things like other systems may have, if you're late for an appointment, past, let's say 10 minutes, some of them have that practice, then they can't see you that day. We have a policy where we see everyone who shows up, if at all humanly possible. It had to be pretty extreme where we couldn't. So removing that barrier for young people so they can get the care they need when they're here. Another thing would be, I'm sure all of you have experienced this. You go into an appointment with your doctor or provider, and you have this one issue that comes up, but you forgot about this other thing, and they can't see you that day for that thing because they don't have time. And so you get seen for that one thing. Another thing that we've done in our services is try to meet every need we can on the day of service when they're in front of us, because once they leave, we may not see them again.
Mhm.
And so try to do as much as we can on that same day is really key. So when I think about current activities now, I think about COVID 19 and the pandemic. What's been interesting to see and sad to see is that these long-standing systemic health and social inequities that have been going on before COVID-19 is like amplified in COVID-19. So we're learning and seeing everywhere that racial and ethnic minority groups are at an increased risk of getting COVID and dying from it. And so we're thinking about, how do we continue to provide service so everybody's safe, but that we can make sure that everyone has access. So we are really putting an effort on providing information and education on COVID-19, and have been since before the pandemic. So young people understand it and how it spreads and what they can do, what to do if they get sick. We provide information on where to get tested, where is there free testing, how to access that. Well, we don't provide testing as a clinic. That's one thing we don't do. So we make sure they know where to go for that. We are offering phone, video, and in-person visits. And so whatever works best, we can make sure that people get that access. We know that some young people don't have access to do a video telemedicine visit. So we can talk to them by phone or see them in person. We just figure out what's
Yeah.
the best way. Um,
Oh,
for COVID, we've also been making sure that what we can do to help with the spread of COVID. So we've created care kits, a bunch of different care kits, kind of fun, like a personal care kit that has masks and sanitizer and gloves and soap and those kinds of things with information about COVID. We've done some that are more like personal hygiene. So it would include things like, body wash, and some of those needs that people have, toilet paper, things that are hard to access. We also have a kit that is for like home cleaning. So it might be disinfectants for the home, laundry detergent, all of those things that many young people that may have hard time accessing, or they've lost employment,
yeah.
harder to get to. Transportation is riskier, so having those kits available in that education.
So I
Um,
wonder, Melissa, that
yeah.
um, with all those things, what are you seeing and observing specifically now through COVID, like, from young people? What are you hearing? What is happening with young people?
Yeah, yeah. It's interesting. Young people, we know one of the one of the really huge things, which I don't think you'll be surprised to hear, but it's sad too, is the higher levels of stress in their lives.
Hmm.
And so how that impacts their health and their mental health. And, it become very complex for a lot of our young people. The social isolation increase, and then having, let's say, a lack of employment or high risk employment,
Hmm.
um, housing insecurity, all of those things are having a greater impact on them. And so we're seeing that and hearing that from young people. We
Yeah.
also know that they're desiring to see us in person. They don't really want to ever do a video or virtual appointment or a phone appointment. And so we are still trying to keep everyone safe and acknowledge that they really have a huge need to make a connection. Even with our health educators, we have great education programs for them right now, that are virtual, and they receive gifts and gift card incentives for participating. They just don't want to do it. They want to see us in person. And so this is a very hard time. They're wanting that connection. And it really shows that a lot of what we've been doing for many years is there's a relationship there. It's not just an appointment.
Yes.
We really do care about our young people.
And that is key. That is really key. I think that's one of the things that really hope that people who work with youth really invest on is that relationship building, and which I know that's what works. And a lot of partners are in that with us. So, what are you most hopeful for and about when you think of our work ahead, Melissa?
Yeah. I think when I think about our work ahead is this idea of um, increasing the way that we engage with youth about what we do. We have some things in place already. We've been doing it for a long time, but how to do that at a deeper level,
Mm-hmm.
to really encourage and uplift youth voice, and to be able to educate ourselves and people we partner with and the community as much as possible on what youth are saying and what they want and what they need, not guessing or deciding or determining for them. And so one of the things I'm looking forward to in the future is training and supporting youth as peer educators. We know that they have a much wider social network system. They trust each other more. And so if we can train and support them to educate their peers on key topics, I think it's very powerful. We believe that, we have some expertise in many areas, but youth are really the experts of their own lives. And so if they have the information to make choice, um, we know that with knowledge, they have power and they're very powerful. And youth can have a huge impact on their lives and their friends and their family and the community at large. No matter what situation they're in, they have a lot to contribute. And I still remember meeting with a group of young people to get some feedback from them on services we were doing. And we were talking about the idea of what do we contribute to our community. And one of the young women who was really struggling with housing, she was homeless at the time. Things just weren't going right in her life in a lot of areas. And she said to me, I'm a really good community member and I contribute a lot to my community. And I said, oh, and inside I was thinking, oh, I never thought of that. And I almost felt ashamed that I didn't think of her in that way. And she explained to me how she was contributing to her community. And it's the things like sometimes we see youth who are homeless as kind of pitiful and needing us and not giving us anything, just taking. And she was contributing in a lot of ways
Yes.
to the community at large and to others. And even just my engagement with her, she was just such a joy to be with. And it was just a really impactful moment for me to remember
Yeah.
young people contribute a lot to our community, and we can encourage them to be the best they can be or be something that's, a negative influence on them. And so I think
Yeah.
that's what I'm hopeful for is powerful youth can change the world. And I believe it
Yeah.
100%.
And they do, and they really have us learn a lot from them. We learn a lot from our young people, and of course, as you always say, really kind of they tell us that they love us, right? And multiple generations of them. So it's an honor and privilege to do that. So why should the community engage with our work and really support face to face, Melissa?
Well, I think everybody who's listening to this, you care about youth. I think that's the biggest reason, because you care about youth, and we can show youth how much we care together. And our approach that we utilize is effective, and so you can trust that. And we're also unique because we're so comprehensive, and so we can meet many needs under one roof. And so we want to amplify youth voice, and you can help us do that. And we know that this is key to ending these disparities that are going on and these systemic issues. Together we can do that. And so because you care about youth, we want to partner with you. We want to hear from you. We want to talk to you. I'll just mention, I'm soon changing roles at Face to Face. I'll be working in development and community engagement. And I would love to talk to any of you about questions you have about our work. If you want more information, if you want to find a way to get involved, if you want to make a donation, if you're interested in volunteering, there's so many ways that we can help you show how much you care about youth in our community, and specifically about their access to health and having positive health outcomes.
Thank you. Thank you so much, Melissa. This has been really great to have this conversation. And we hopefully, from your different role as our next development person, you would be able to come in and talk specifically about the many ways that we can have our community support this work. And I am so grateful and thankful for the work that we do every day at Face to Face and for our community. And at this time, please take care of yourselves, and we will be back next month. Thank you for all for tuning in and listening.